Yeah,
Thank you.
excellent. Okay, so yes, we're trialling this as a way to engage with potential candidates, to give you a little bit of background about Birmingham City Council, the Public Health Division, and a bit of information about the job itself, how to apply, where to apply, and then just a chance to answer any questions that you might have. So we've got Thomas Harwood on the line, who's our head of office, and Charlotte Beresford, who supports Thomas in workforce organisational development. I think that's right. Is that Charlotte? Yeah. Okay, so we've got half an hour, so hopefully that should be enough. I certainly don't have to dash off if there's any questions by the time we get to past that we want to continue to answer. But just to give a bit of background about the service lead role, this is within the adults team to manage a small team of staff, leading on the delivery of healthy lifestyle programs and mandated public health services, specifically sexual health services, and to coordinate the Birmingham Fast Track Cities Plus initiative, which is looking to reduce HIV, bloodborne viruses, and TB. So that's just a high-level overview of the role, and Juliet will say a little bit more about that later. So if we move on, so why Birmingham City Council? Well, Birmingham City Council, local government body responsible for the governance of the City of Birmingham. It's the largest local authority in Europe, and has just over 1.1 million citizens within the city boundaries. And our work is to make a difference to every citizen of Birmingham, and what we do, making what we do today matter, but also for future generations to come. For those who might not know, we're the youngest city in Europe as well, with 40% of the population under 25 years. And the positive is our youthfulness provides relentless spirit and ambition, ensuring the city always has new achievements and breakthroughs. We are also a super diverse city. We are now a majority non-white population, just over 51%, 48.6% white. And there are significant pockets of inequalities, challenges for the city. But on the positive, we have very clear strategic objectives across the city in our corporate plan, and also very strong networks and connections with our key partners through the Birmingham Health and Wellbeing Board, and a very clear strategy for how we want to improve health and wellbeing through our bolder, healthier Birmingham strategy. The division itself is a big division and aims to provide world-class specialist public health, supporting evidence-based public health delivery approaches that protect and improve the lives of our citizens in our city. It's about helping people to stay healthy, protecting them from threats to their health, and you might be aware that obviously public health became a statutory function of the council in 2013 through the Health and Social Care Act 2012. So the three domains of public health that we cover are health protection, health improvement, and healthcare public health. So just to give an overview of the Public Health Division and its structure. So the Director of Public Health is Dr. Justin Varney, who oversees and manages the whole of the Public Health Division. And within that, there is a Deputy Director of Public Health, and for 5 assistant directors of public health that cover the 5 different areas: healthy behaviours and communities, children, adults and older people, which this post sits within, health protection and environmental public health, and knowledge and evidence. And underpinning those 6 key roles are the support functions to enable the division to operate effectively. So we have the Public Health Office, Public Relations and Communications, and behavioural science teams to support those different life course and setting programme areas. Move on. The Public Health Division prides itself on supporting staff to progress in their careers within the public health discipline. So this slide gives an overview of that career progression ladder. So we have public health graduates at the base of the pyramid and support officers that come in, and then we have the progression through to a public health officer role, then a senior officer public health role, then the public health service leads, of which this post is one of them. Then we have now just got 2 training portfolio lead posts to support people to become registered on the specialty public health register. And then the consultants and assistant directors of public health, and leading to the director of public health role. So we aspire to supporting all our staff to progress through this ladder to us wherever they feel they want to achieve what they want to aspire to. And there is considerable support, training, coaching, mentoring that we offer to enable people to do that. On the left-hand side, you'll see there that we encourage and support staff to register on the UK PHR practitioner register to move to a senior practitioner, and then to register through the portfolio, through the specialty training programme, to achieve specialist registration, which then obviously enables people to take up posts and consultants in public health roles. So I've mentioned obviously about the support. We feel one of our aspirations, values, is to support staff at all grades, and we have a number of packages and a package to ensure that once someone is in post and service leads receive necessary support from the wider team and across the Birmingham City Council. Obviously, our work in public health does extend into different directorates across the council, and we're committed to supporting people to get exposure across the council in different roles to develop their competencies and their knowledge. So the Assistant Director and the Deputy Director of Public Health provide supervision. And as I've mentioned, we have access to the West Midlands coaching pool, mentoring pool, which is free to Birmingham City Council staff. Being bold yourself is important to us, and we have a number of corporate networks to support you. They're listed there. They're made up of staff across the organisation. They are very active, and they do provide support and information not only to other staff but also to the corporate leadership team. So I'll hand over now to Juliet, who will just talk through the JD and person spec.
Thanks, Becky. So I'll go through some of the processes and things that you might want to think about if you're going to apply for the role, but I'll also say a little bit about what the kind of day job is in terms of this service lead role particularly. So just in terms of the process first then, obviously there is a pack that's attached to the job advert that's got the job description and the person specification within it. The job description is quite a large document, and it covers quite a lot of the kind of high level activities, I think, that the service leads across the division all have to cover. And I think within the job description, it also covers off the other service lead areas as well. So that's really worth having a look at in terms of the kind of expectations and the level of the role and the kinds of interfaces that you'll have with the other service leads in the team as well. So it's a really kind of good overview. But I would encourage people to really look at the person specification and in terms of the essential criteria and those areas of that person specification that you'll need to demonstrate if you're putting an application forwards, both for the application form process itself, but also in terms of the interview and any presentation or other kind of competence that you might have to demonstrate as part of a test. But that should all be included in the person spec in terms of where you will actually be asked to demonstrate those competencies. So I would focus particularly around the person specification if you're looking at applying for the role, and then looking across those in terms of your current experience, your training, your qualifications, to look at where you match some of those kind of core competencies, particularly the essential ones. So in doing that, in terms of formulating a response to those, because you will be asked to provide a personal statement as part of the application, that doesn't include a CV. So CVs don't count as personal statements. It really is about you describing and providing evidence of meeting the criteria in the person specification. In terms of the way that the application's assessed, so there is a panel that's established, and the panel will do all elements of that process, from reviewing applications to shortlisting and then interviewing as well. So there's a consistency in terms of the panel, and all of the panel have had to do the training that BCC require any recruiting manager or any recruiting staff to go through. So in terms of the kind of day-to-day job then, which you don't always get from looking at job description and person specification, Becky did touch on it at the beginning of the session. Essentially, the main portfolios for the roles are there are 2 mandated services for public health that this particular portfolio covers. So Becky's talked about sexual health. There are also NHS Health Check. The NHS Health Check programme is part of the adults service responsibility. That, along with the smoking portfolio that the team hold, means that we've got quite a few contracts, over 200 with GPs and pharmacies individually, to deliver both smoking and NHS Health Check services. So potentially goes without saying, there's a lot of contract management and financial parts of the role that you would need to be kind of really comfortable with performing. So kind of previous experience of kind of finance, contract management and commissioning would be beneficial in terms of particularly this service lead role. Because of the statutory nature of some of the services that we manage, so sexual health, NHS Health Checks and smoking, we have to have a fairly strong relationship with the NHS and particularly the ICB in terms of the pathways and delivery that overlaps with NHS and some of the pathways that we are developing and evolving with partners. There's another area of work as well, which is adult weight management, which we are currently reviewing, and we are procuring in terms of targeting certain populations around adult weight management. And there is also a commitment to looking at workplace health as well as part of the next phase of the team's plan development for next year. So a new area of work for the team, but I think one that crosses over in terms of kind of some of the lifestyle support offers that we already deliver and commission. So those are the kind of main areas of this service lead role. And then I'll touch again on the process in the next slide. Okay, so yeah, just to be really clear, not to submit a CV. A personal statement is much more about how you meet the competencies in the person spec. Yeah, I think there's some duplication on the slides a little bit, aren't there? So make sure you complete all sections of the application form, check the eligibility criteria. We talked about the personal statement, which isn't a CV. Really look at the person specification and the skills list. Make sure that you're responding to all of those in terms of your application. Obviously, you've met kind of Becky today and myself, but if you've got any further questions about the application process or kind of skills experience that you want to explore a little bit further, then please get in touch with Becky. And the council can't accept any applications made after the deadline. Hopefully you'll know where to find and apply for the job. So all of the Birmingham City Council public health jobs are advertised on West Midlands Jobs. And in terms of just some background and context that might be helpful if you are making an application for the role. So we've got our Healthy Brum and the Bolder Healthier Champions web pages and information that it'd be really worth having a look at. There's a really good series of webinars and publications around all of the work that public health in Birmingham does. So these are kind of just a selection. Really benefit, I think, from looking at the community health profiles. As Becky's mentioned, that the adults team particularly manage the Fast Track Cities Plus programme, so really beneficial for you to have a look at that. Anything around the kind of sexual health work that we do. And there's a lot of content on some of these web pages around our smoking offer and some of the work we've been doing around promoting smoking cessation. So have a look at what's available in terms of the work that we've been doing on our Healthy Brum channels. Okay, thank you. Happy to take questions.
You'd think I've got used to it by now, but thank you, Juliet. And yes, just to reiterate, the closing date is the 26th of November. We can't take applications after that. We're hoping to shortlist early December and hopefully interview during December, because obviously we're looking for someone to start in the new year as soon as we can. So yeah, just open it up if anybody's got any specific questions or clarifications they want.
No questions from me. It's pretty thorough, thank you. Yeah.
Okay.
Danny, any questions from you?
No, it seemed pretty on the nose, to be honest. So yeah, no, it was really useful.
Thank you very much. Well, we have recorded it and we will post it. If you've got any other questions, Becky, I'm not sure, Fidelia, you've got Becky's email address. Danny, do you have Becky's email address? It should be on the advert, but we can pop it in the chat just in case you need it.
Yeah, it's on the advert. Yeah, I've just got it up.
Brilliant, thank you. Well, if everyone's happy, let's conclude. Thank you for your time, everybody.
Thank you.
Excellent.
Take care.
Thank you. Thank
Bye-bye.
you. Bye.